the horrors that have been visited on people in Gaza are beyond what we can imagine. The loss, the multiple loss, the grief, the fear that they have been put through over the last 120 days is beyond anything anybody can imagine. The problem is that all mental health interventions rely on the idea of post-traumatic aid, but we're not in the post-trauma part yet. And that everyone, all 2,300,000 or people in Gaza have been injured in terms of their mental health, and have seen things that shouldn't be seen, have lost loved ones. We then look at the social damage or the social wounding that is happening to both the wounded and the children who are not physically wounded. And that is the loss of one or both parents. And this is compounded usually by the fact that this loss happened in the home. And so this loss is associated with the loss of the house. And so we are getting children, around 20,000 children, as Abir said, who have lost one or both parents, almost all of whom have lost their homes, many of whom have lost both parents and extended families. And I remember when we were at Shifa, we were noticing this phenomena of wounded children with no surviving relatives. And there were around 120 of them. And these had no distant cousins from either side of the family left when they were taken out of the rubble. And so the complexity of the challenge that is going to face the Welfare Association in running its and upscaling its orphan sponsorship program is really mammoth, and is going to require an organization that is within Palestinian society because of the sensitivity of the issue at hand. These are the children of martyrs. These are kids whose parents were killed as a way of ethnically cleansing what remained of Palestine. And so it's critical that Palestinian institutions oversee, if not deliver, the care that these children need to ensure that their care is not part of the ethnic cleansing aims of the war, but actually that they're cared for as much as possible within Gaza and as much as possible within extended families, and that these extended families are supported. Unfortunately, a lot of these children, orphan children, are either wounded, as I said, or that their carers are wounded. And so this program will need to be sufficiently nuanced and individually targeted so that each child's specific needs are met, because the layers of social destruction are going to be different for each of these children.